Greetings, fellow humans. I'm just home from presenting at the Royal College of GPs Managing Addictions in Primary Care Conference at the Lowry Hotel in Manchester. My session was on trauma and resilience informed practice, what it is, what it isn't, and how it can change the world. And I'm making this, I don't normally do this actually, but I'm doing this because it was just a really powerful experience. I met so many amazing people from different backgrounds to mine. I'm a clinical psychologist. We met lots of people from GPs and people working specifically with addictions. And we just connected, and I was so impressed by how much of what I said resonated with people working from who were trained in a different discipline, but actually we both understand the contribution of trauma and adversity to people's difficulties, and in this case to people's addictions. So just a huge thanks to the people that were there for my talk, and they were very generous and attentive and asked lots of very thoughtful questions, and a big thanks to people who came up to talk to me afterwards, because as a presenter that's always a really, a wonderful kind of generous act on behalf of people to come and get out of the seats and come and speak to you and connect with you on a human level. That's tremendous. And I hope my messages would land. But I'm really delighted to discover that there's a huge appetite for trauma and resilience informed thinking and approaches, and the application of science to working with people with addiction. I'm really pleased that people got the idea that routine and targeted inquiry is really important. And actually, if we ask people about what happened to them, we can probably help them a bit sooner. We can give them the right help, and we can continue to support them by addressing the source of their pain, not just the symptoms of their pain, which might be addiction for gambling or drugs or alcohol or whatever it is. And my take-home message was, we can't just keep treating the symptoms and ignoring the cause. We've got to get to the origins of the pain, and that really involves asking people what happened to them in a sensitive and thoughtful way. I kind of always finish with the words of Desmond Tutu, and my final contribution was, we have to stop just pulling people out of the river. We've got to go upstream and find out why they're falling in. And in terms of, addiction, that's totally part of the solution, is finding out why people are in pain, why they're still seeking pain relief, why they're still in distress, what contributed to that in the first place. So yeah, it was a really great event. Big thanks to Dr. Stephen Willits for inviting me and championing my contribution to this event and my session, and a big thanks to the organisers and to Jess and Kelly who organised things and my contribution brilliantly. I've had a great afternoon. Thank you so much.